Namaste, I'm Siddhi Pranam. Welcome to your today's topic, which is understanding postpartum depression. So, when we look at understanding PPD, postpartum depression, also known as PPD, it's a type of depression that affects some women after giving birth. It typically occurs within the first year of after childbirth, and although it can manifest shortly after delivery or even during pregnancy, also. Postnatal depression is more than just the baby that many new mothers experience. It's a serious mental health condition characterized by persistent feeling of sadness, hopelessness, guilt, anxiety, and loss of interest in activities. Symptoms of postnatal depression can vary, but it usually includes persistent sadness or mood swings, loss of interest or pleasure in activities that are once enjoyed, and feelings of worthlessness or guilt, fatigue or loss of energy, changes in sleep patterns, usually insomnia or excessive sleep deprivation, also difficulty concentrating or making decisions, thoughts of self-harm or harming the baby. So it's really important to know that postnatal depression is not a sign of weakness or a failure as a mother, but it can be caused by a combination of hormonal changes, sleep deprivation, stress, past mental health issues, and the challenges of adjusting to the motherhood. Now, how yoga can help overcome postnatal depression? Yoga can help be a very helpful complementary therapy in managing the postnatal depression. And some of the ways that it can help is first reducing stress. So yoga, as it incorporates breath work and mindfulness techniques that can help reduce stress and anxiety, which are common symptoms of postnatal depression. So it really helps reducing the stress. Then it can also help with mood enhancement. So practicing yoga releases endorphins, which are feel-good hormones. This can help lifting the mood and also counteract the feeling of sadness. Yoga also encourages stronger connection between mind and body, which can help new mothers to become more aware of their emotions and address them more effectively. Many yoga practices also focus on relaxation, and it can aid in improving sleep patterns, which are often disrupted during the postnatal depression. And when the mother joins yoga classes, it can provide opportunity for the new mothers to connect with other mothers that are experiencing similar challenges, and it can build a supportive community for them. And mastering yoga poses and progressing in the practice can give them a sense of achievement and empowerment, which can boost their self-esteem. And when teaching a yoga to a mother with postnatal depression, it's really essential to approach the practice with sensitivity and understanding. So creating a safe space is very important here. Ensuring the yoga class or the session provides a comfortable, non-judgmental environment where a mother can feel at ease is very crucial. Postnatal bodies can be delicate, so we need to offer modifications that are gentle and suitable for particular mother's needs. And we need to let the mother know that it's really okay to take breaks and modify the practice whenever needed, and avoid pushing too hard or set any unrealistic expectation from herself. Then yoga can also be a valuable tool for promoting emotional balance and well-being during the postnatal depression. So when teaching yoga to a new mother experiencing postnatal depression, we need to focus on gentle and nurturing practices that can help her connect with her body, breath, and emotions. So we can start each session with mindful breathing and encourage new mother to sit comfortably with eyes closed and take deep breath, and inhale deeply and exhale slowly can help calm the nervous system and reduce anxiety. We can incorporate gentle restorative poses that focus on hip opening, chest expansion, and gentle switch. And these poses will release tension and promote relaxation and improve the flow of energy throughout the body. Some of the common postures would be cat-cows, bridge, supported bridge pose, or butterfly postures, seated forward fold, or these could be really beneficial. We can also introduce Yoga Nidra, which is a guided relaxation technique to help induce state of deep relaxation and also reduce stress, and this can promote emotional healing. And we can use loving kindness meditation, and when we incorporate loving kindness or metta meditation, this can cultivate feelings of self-compassion and self-acceptance. We can encourage the mothers to direct kind and loving thought towards themselves and their baby. And we can teach calming pranayama techniques like alternative nostril breathing or Sitli pranayama, which is a cooling breath. And these practices can help regulate their breath and also clear their mind and balance their emotion. We can use positive affirmation during each session to encourage the mothers to repeat the affirmations related to self-worth, strength, and resilience. For example, I'm capable and loving mother, or I'm doing my best, that is enough. And we can also incorporate guided visualization exercises where mother can imagine herself in a serene and peaceful environment and feeling calm and experiencing emotional balance. We can also incorporate gentle flow of sequences that can promote a sense of fluidity and freedom in the moment. And we can emphasize on breathing exercises also. At the time of practicing the flow, they can focus on their breath and focus on their bodily needs. And if possible, we can organize yoga session with new mothers that are facing similar challenges, and a group support can really foster a sense of community and understanding, and also reduce feeling of isolation. And then we can remind the mothers that her feelings are valid, and it's really essential to be kind to herself during this time of transition and encourage self-compassion and discourage any self-criticism. And then we can connect and create some support structures around her, and we can encourage her to join postnatal class regularly, and that these classes are designed to address specific physical and emotional needs for new mothers, and attending specialized postnatal classes can provide her consistent and supportive environment where she can connect with other mothers that understand her experiences. While yoga can be helpful, it should not replace professional mental health support. We can encourage the mother to seek counseling or therapy to address postnatal depression. A mental health professional can really help offer personalized guidance and support her tailored needs. And also, we can encourage her to practice regularly yoga at home, and simple and gentle postures, breathing exercises, meditation can be incorporated into her daily routine, even if it's just a few minutes each day. Many communities also offer mom-baby yoga classes, and you can also do that. And when you offer that where mothers can bring their infants along, these classes really become a very supportive environment for mothers to bond with their babies while practicing yoga together. Now, we can encourage new mother to lean on her support network, such as families or friends whenever needed, and having someone to talk to and help with daily tasks can be a tremendous source of emotional support during this time. We can also encourage her to look online support groups, forums specifically focused on postnatal depression, and connecting with other mothers who have experienced the similar challenges can create a sense of belonging and validation. And incorporating mindfulness technique into the daily life, both during yoga practice as well as throughout the day, and being present in the moment can also help anxious thoughts to release and also increase self-awareness. And then we can encourage her to set realistic expectations for herself and for the baby, and being patient with herself and not to compare her journey with others. She can also journal and write down 3 things each day that she's grateful for, and this practice can shift her focus to positive aspect of life and also promote positive outlet. Then self-reflection and self-compassion is also powerful tools to navigate postnatal depression. This allows new mothers to gain insight into her feelings and experiences, and as well as to treat herself with kindness and understanding during this challenging time. And we can encourage her to acknowledge and validate her emotions without judgment. And it's really essential for her to understand that postnatal depression is real and valid condition, and it's really okay to feel overwhelmed and sad. We can also guide her to keep a journal where she can freely express her thoughts and emotion. Writing can be a very cathartic process and may provide insights into her experiences and emotion. And she needs to be set realistic expectations for herself and her healing journey, and needs to understand that she may not be able to do everything that she did before having a baby or before having this mental condition. And we can encourage her to embrace and focus on small achievements and her little progress each day. And then we need to encourage her to use self-compassionate language when talking to herself instead of being critical, and also encourage her to treat herself with same kindness and understanding that she would offer to someone going through the same challenges. And then we need to challenge some negative thoughts. So we need to replace them with more balanced and positive ones, and this can help reduce the impact of negative self-talk. And we can encourage some others the importance of self-care during this period, and prioritize her physical and emotional well-being by engaging in activities that bring her joy and relaxation, and also motivate her to celebrate every small accomplishment during the way. And each step forward is a significant achievement in the journey of overcoming the postnatal depression. And these practices, we can include certain practices, gentle movement practices, which can also be supportive. So these practices can improve mood, reduce stress, and promote overall well-being. And first is walking. We can really include walking into mother's daily routine. Maybe just carrying the baby in the stroller, and carrying can be walking in the fresh air, and that can clear your mind. And walking in nature can have additional mental health benefits. And encouraging the mothers to strengthen the pelvic floor muscles is also crucial after childbirth. So when they practice Kegels, that will also help them. Plus, when they are taking care of themselves, this will also encourage them to continue on their journey. We can also encourage them to practice mom-baby yoga, where she can practice together with the baby, and this will help in the bonding process. And we can encourage her to practice restorative yoga with props, and that will support in relaxing more. And including stretching to her daily routine will also elevate tension and promote flexibility, and paying also special attention to the areas that might be tight due to childbirth, and also carrying the baby can also be a good idea. Dancing can also be a great therapy, so we can motivate her to put some music on and dance around the baby. Dancing is not only enjoyable, but also a great way to release endorphins and body's natural mood elevators. And then online classes. We can really explore online resources and online journals, or maybe some practices that can help connect with similar, or maybe if she loves certain practices, she can be part of those online groups if she has some hobbies, etc. Swimming is another great option. If the doctor approves, mother can consider swimming as a low-impact and soothing form of exercise to include in her routine. And then cultivating a positive mindset and gratitude is really important. So shifting her focus from negative talks and negative thoughts and emotions, and we need to foster resilience and promote more optimistic outlook. So positive affirmations can help mother create an environment where she can engage into that safe and loving space all over again whenever her mind is too cluttered with negative thoughts. She can use affirmations like I'm loving and capable mother, I'm strong and resilient, and this can reinforce positive self-image and mindset. So when she keeps going on in her recovery journey, she might like to, with every little steps on the way, even if when she's able to get that extra rest or eat that one nutritious meal or take a moment of self-care, all these are small achievements that she should celebrate, that she's working towards getting healed from her depression. And encouraging the mothers for practicing mindfulness meditation to be present in the moment without judgment can also be great. So mindfulness can really help observe negative thoughts without getting caught up in them and create a space for more positive perspective. And then surrounding oneself with positivity. So encouraging the mother to seek out supportive and positive influences in her life and motivate her to spend time with friends and families who uplift her and offer encouragement. Ask her to minimize exposure to negative news and content that increase anxiety in any manner. Then motivate her to engage in hobbies and activities that bring more joy and relaxation, whether it's reading, painting, gardening, or listening to music, or engaging in activities that she loves and that will boost her mood. And limiting social media use. So you can encourage her that excessive scrolling can sometimes lead to comparison and negative feelings. So she should focus on real connection and avoid comparing her journey with others. And encourage her to seek out postnatal support groups and communities where she can connect with other mothers who may be experiencing similar challenges, and sharing her experiences and support can be empowering. So and then focusing on her presence, so you can encourage her to be present with her baby, cherishing the beautiful bonding moments of joy in motherhood, and let the worries of the past, future to let go. And then importance of seeking professional help. So postnatal depression is a serious mental condition that might require appropriate assessment, support, and treatment. If you suspect that you may be the mothers may be experiencing postnatal depression, and they're struggling with their emotions, and regardless of the practices, sometimes some mothers are not even prepared or ready to practice meditations, because the moment they go silent or try to sit alone in that space, their mind or thoughts becomes more harming towards them. Then that's a severe condition. They are not even ready to get onto the healing journey. In these kind of cases, professional help is really required. So we need to be aware of when is the right time to suggest the mother to go to the doctor or mental health professional. So we really need to encourage the mothers to talk to their doctor, their midwife, or general practitioner to discuss their feelings and experiences, and they can provide an initial evaluation to refer to the mental health professional who specializes in postnatal depression. Then motivate her to schedule an appointment with a psychologist, psychiatrist, or counselor who has experience in treating postnatal depression. They can provide a comprehensive assessment and develop a tailored treatment plan. And you can encourage her to involve her family members or close friends and discuss about her feelings, and also understanding that she's seeking support at a certain point in time. And their support can actually make a significant difference in her recovery journey. So you can also encourage her to educate herself on the topic of postnatal depression and the available treatment options. So understanding the condition can empower her to make informed decisions in her situation and also consider therapy options. Depending on the specific needs and preferences, we can encourage the mothers to explore various therapy options like cognitive behavioral therapy, also known as CBT, and mindfulness-based therapy or interpersonal therapy, each approach may offer different benefits in managing postnatal depression. Now, there are medication also, and in some cases, doctors may recommend antidepressant medication to elevate symptoms of postnatal depression. But we always medication should only be taken under the guidance of the healthcare provider. And then, if she receives a treatment plan, then we can always encourage her to follow the treatment plan that is given by the health professional. We can ask her to attend therapy sessions regularly and take prescribed medicines as directed by the doctors. And then she needs to prioritize self-care. And this will, we can motivate her to engage in activities that promotes relaxation, reduces her stress, and works on her overall well-being. And then we can monitor her progress and keep a track of her emotional and physical progress. If you notice any improvements or concerns, you can communicate them to the family member, or if you know the healthcare provider or doctor, that's when you can approach, or you can let her know to communicate it to the right person. Now, yoga may be used as a complementary approach alongside the professional mental health support, and as yoga can be really helpful in uplifting the mood and releasing the endorphins, the feel-good hormones are released after the yoga practice, which can counteract the feelings of sadness and hopelessness. And it does provide relaxation also, which can improve her sleep, and also it can empower her with a sense of achievement, or boost her self-esteem that she's able to do at least few things. And also it can provide that space to release her emotions and express her emotions and feeling in a supportive environment. And it can reduce physical tension also that has built up in her body after childbirth, maybe help with the pelvic floor or back pain or hips or hip pain, and also elevate physical tension around other areas of the body. And this can also help her have improved body image, where this can promote have more body acceptance, and also embrace her post baby body with a lot of compassion and positivity. And when we practice mindfulness and coping skills, the practice of mindfulness that is learned in yoga can be applied to daily life also, which can help her develop healthy coping skills for managing stress and difficult emotions. I hope this was helpful and you really understand the deep underlying condition of the mother going through postnatal depression and how you can help manage. And if you come into interaction with the mother going through this, you will be able to support her better through this understanding. I hope this contributed to you, and you will contribute to many, many lives through this. With that, thank you and namaste.